A 63-year-old man with type 2 diabetes mellitus comes to the office to discuss his new diagnosis of prostate cancer. He has agreed to further treatment for his condition, but he appears anxious and says, "I don't know how I'm going to handle this. My father died of cancer, and I'm worried the same thing will happen to me." He adds, "Sometimes I just feel like giving up." He is not actively suicidal and denies any current plan or intent to harm himself. Which of the following is the most appropriate initial response by the physician? Choice A. Most prostate cancers are slow-growing, so you probably don't need to worry. Choice B. It's best that you don't trap yourself in negative thinking and focus on your current treatments. Choice C. If you are open to it, I could schedule you for regular visits during your treatments. Choice D. Treatments have come a long way since your father's time. Your experience will be different. Choice E. I can prescribe a drug called sertraline for you if you are struggling with your mood. 5 seconds and I'll answer the question. Ethics question. So as usual, you have to be patient-centric. You need to validate and acknowledge the patient's feelings and make sure you read the question carefully and that you are addressing their primary concern. Here, his primary concern is his mood and how he feels about the treatment, how he feels about going forward. So choices A, B, and D are all wrong because they all kind of minimize his feelings. You're kind of sweeping them off to the side instead of giving him something that will really encourage him. And choice E is incorrect because even though he's feeling kind of down, and yes, it's possible he might develop depression from his bad prognosis or his bad diagnosis, you don't jump straight to giving an SSRI like this, especially because the question doesn't really give enough information for you to conclude a diagnosis of MDD. So of course, choice C, if you are open to it, I could schedule you for regular visits during your treatments is the correct answer, because in order to address the patient's feelings and his concerns about his mood and to support him over time, you're going to need to schedule more follow-ups, because obviously being overly paternalistic or dismissive of his feelings is not going to be helpful at all. The best you can do is really just provide him with the knowledge that you can be there to help him through it if he is willing to show up to additional appointments. Shouldn't be too hard of a question, honestly, but sometimes people get mixed up about these. I hope you found this video helpful. I'll see you in the next one.